I'm Dr. Rajesh Raveendranathan, popularly known as Dr. Raj. I'm here to speak to you about neuromuscular dentistry and how it helps solve temporomandibular joint disorders and obstructive sleep apnea. I've finished my fellowship and mastership from the International College of Craniomandibular Orthopedics, the only organization where neuromuscular dentists form a huge part. I'm trying to bring that to India so that the lack of awareness about neuromuscular dentistry is wiped away. In this video, I'm here to talk about how temporomandibular joint disorders and obstructive sleep apnea can cause a lot of problems in your day-to-day life. We need to find out how exactly these happen, but for that, you need to know what the TMJ is all about. I'll be explaining all this in very common terms using simple language so that everyone understands what this is all about. The TMJ is actually the temporomandibular joint. It's formed by the union of the temporal bone of the skull and the lower mandible, which is actually the upper jaw and the lower jaw. Every body is made up of a joint. A joint is where two bones meet. For these two bones to move against each other smoothly, there would be some sort of a lubricant that helps the two bones move. Fortunately, in the TMJ, it's a piece of tissue, otherwise known as the disc. When this tissue gets abraded away, you end up with problems known as temporomandibular joint disorders, otherwise known as TMD. The faulty positioning of the lower jaw, which actually means the lower jaw is pushed upwards, backwards, and inwards. So what actually happens is there is pressure formed within the joint space. So when the mandible goes behind and presses onto the tissue and he chews wrong, he grinds wrong, the tissue abrades away. Naturally, when the tissue abrades away, there's a nerve that travels within that joint. It's known as the mandibular nerve. So what happens is, when the two bones meet, you hear the first symptom, which is the click, because the two bones are abrading against each other. The next step would be pain, because every time you do something with your jaw, like talk a lot or chew something, the nerve gets crimped. As time goes by, you would eventually see that the clicks just disappear. It's not good news, it's actually bad news, because what's actually happening is the two bones are fusing together and you end up with a loss of opening. So the mouth opening reduces to an extent wherein one day you end up with a locked jaw. Disc abrasion is caused due to a variety of factors, such as loss of teeth, improper chewing habits, malocclusion, congenital birth defects, sleep apnea, night grinding. All these would eventually lead to the malpositioning of the lower jaw. Every time the lower jaw changes its position within the human body, there is a problem within the joint space as well. This causes the disc to be either medially displaced or anteriorly displaced and causes a lot of symptoms. The symptoms could vary from person to person. They normally end up as headaches on the back of the head, on the top of the head, temporal headaches, pain around the eyes, behind the eyes, on the TMJ area, ear pain, itchiness in the ear, tinnitus, sinus issues, dental pain, throat issues, and etc., etc. Some patients suffer from just one of these problems that I've mentioned, and some suffer from a lot of these, or maybe even all. And they're in real big trouble because they actually suffer from a syndrome known as MPDS, which is Myofascial Pain Dysfunction Syndrome. And most of these patients have been misdiagnosed. Hence, diagnosis forms a huge part in treatment of TMD and its problems. Diagnosis forms the most important part of treatment of temporomandibular joint disorders and its problems. We usually depend on X-rays such as the lateral ceph, the OPG, the TMJ view, left, right, open, close, CBCTs, MRIs, sleep study, but I would feel the most important part would be the questionnaire, because as long as you don't see the patient directly, you can never come to a conclusion as to whether that patient is suffering from TMD or not. So how do we get this treated? Neuromuscular dentistry involves the relaxation of the stressed out muscles that are holding the lower jaw in the faulty position. How do we release them? How do we relax those muscles? There is a protocol that we follow. The protocol would first involve using a TENS machine on the joint area. What it actually does is it provides pulsing to the nerves that supply the muscles holding the jaw in the wrong place. Once these muscles relax, the jaw virtually drops down, forward, and on the frontal side, on the medial. Once this is achieved, we are actually creating the space that was lost in the first place. Once we've achieved the joint space that is ideally required for that patient, that space needs to be maintained. This forms a very important part of neuromuscular dentistry. It's known as the second phase. The orthotic cannot be worn for more than 8 to 10 months because it's naturally plastic, so it's going to abrade away. And once you remove it, the patient would tend to, the jaw would actually tend to glide back into the old position and create all those issues all over again. So to avoid that, we need to permanently close up that space. This can be done by building up crowns or can be done by orthodontics. I'd prefer orthodontics personally, but when you have less teeth, missing teeth, prosthodontics would be the way to go about it. Once the second phase is over, the patient is normal. We confirm all our patients with the help of a T-scan to make sure the microocclusion is also perfect. As you can see, the cervical posturology is also very important. With every change in position of the lower jaw, there is a change in position of your cervical vertebrae. Because the TMJ forms the first point of your postural chain. So we need to ensure that the neck is perfect, which is where the chiro comes into the picture. While wearing the orthotic, initially the patient would go through some problems. These problems would vary from inability to speak properly or pain, being loose, being tight. It's all a matter of 3 to 4 days. Once you get used to it, it's going to be super fine. Also, we make sure that all the patients understand the importance of patience. This treatment is all about cooperation. The doctor does his job, we need the patient's cooperation. As long as there is no cooperation, the treatment is going to be really, really difficult. As part of this cooperation, we ask the patients to make sure they are on a semi-solid diet for the first 1 month. Some biting exercises so that they learn how to bite properly with the orthotic on. Some yoga, breathing exercises. All these help in the overall well-being of the patient. To achieve success in treating TMD patients neuromuscularly, we need to have a good team. The team should ideally involve a neuromuscular dentist, a chiropractor, a neurologist, an ENT specialist, a psychologist, a massage therapist, and a physiotherapist. Only if all of us work in tandem together would this problem be properly eradicated? So this is the gist of how neuromuscular dentistry helps us in treating temporomandibular joint disorders. It's all common sense, it's logic. If you have any further doubts with regard to neuromuscular dentistry, please log on to tmjindia.com. I'll see you soon.